The first session is my pleasure to moderate, and it's entitled Pancreatitis to Pancreatic Cancer Continuum. This is actually a slide that I'm going to start with that Dr. Go published an article a couple years back that shows the disease starts to appear in the 40s and 50 age range, but then increases with age. The genetic factors underlying pancreatitis accounted for about 15% of this incidence. Smoking 25%, obesity and inactivity 15%, dietary factors 35%, and pancreatitis and others 10%. Most of it is some way or another environmental. Those are things that we're acquiring during our life, either from dietary and smoking habits, or maybe pancreatitis. Pancreatitis includes some major pathobiological processes. One is inflammation, and the other is cell death. Inflammation is like inflammation anywhere, from the skin to the lungs to the heart, etc., liver, etc. It's an inflammatory process, and that inflammatory process is associated with the cells in the pancreas actually dying. So we lose function of the pancreas. And when we look at the disease over time, actually the organ gets more and more and more abnormal as time goes on, and it develops scarring. So most importantly, as this time goes along, these patients have extraordinarily increasing risk of pancreatic cancer. The scarring is mediated by this green cell. So what is that green cell? So first of all, this is the picture of the pancreas tissue under the microscope, a histological picture. And it has two components to it. One is called the exocrine pancreas that makes our digestive function, and the endocrine pancreas, which this circle represents, which is important for metabolism. In fact, that's where insulin is made and secreted. What I point out in this slide is around all these cellular structures, it's called a stellate cell, that's important for organizing these structures in the pancreas. However, with these inflammatory and scarring processes, these cells start to proliferate and make all the scar. They're the scar formers. And even more importantly, when we go on to pancreatic cancer, these play an intimate role in promoting the cancer. In fact, alcohol abuse is one of the major causes of scarring in the pancreas and liver. It mediates cirrhosis, and this shows that alcohol abuse activates this cell, which has effects both on the liver and pancreas. And the other thing I want to point out in the pancreas is that tobacco smoking is a key activator of this cell as well.